My name is Madeline Robinson. I'm one of the clinical coordinators on the Garden Neuroscience Neurosurgery Unit. And so we welcome you here at Henry Ford West Bloomfield Hospital, where you can experience a state-of-the-art service and exceptional care for your spine condition. So the goal of the spine prehab program is to prepare you for your surgical experience, your hospital stay, and your spine therapy, rehab therapy. So what is prehab? Spine prehab, we encourage you to increase your level of aerobic activity, which includes cardio activity, running, walking, those kind of things, and strengthen your core muscles prior to your surgery. Your core muscles would include any of your torso muscles, your abdomen, your back, that kind of thing. Core exercises and muscle conditioning in advance of surgery improves outcomes by decreasing your pain level. It helps to improve your mobility, and it augmenting return to your functional state. Here at Henry Ford West Bloomfield, we emphasize on healing. We have advanced clinical services for neurosciences, orthopedics, cardiology, and cancer. We have all of our rooms are private, and they do, you can see the outdoors, the nice atrium and the pond view from our rooms. We also emphasize on wellness. And by doing that, we utilize our greenhouse to grow our own fruits and vegetables, and we also host farmers market on Wednesdays, where you can come and buy fruits and vegetables. On-site wellness center also offers cooking classes where you can learn about different types of food and how to cook it, yoga, and massage therapy. So our spine surgery team here at Henry Ford West Bloomfield is one of the busiest centers in the region, where we treat a spectrum of simple to complex spine cases. Our spine surgeons are board certified or fellowship trained. We offer multiple surgical options, including minimally invasive procedures. Our strength is the multidisciplinary team approach, where we partner in neurosurgery, physiatry, orthopedics, pain services, neurology, interventional radiology, physical therapy, and occupational therapy. Our spine surgery here at Henry Ford West Bloomfield, you and your spine surgeon have already hopefully discussed and established a surgical plan for you. Depending on your surgery, there will be variations of physical therapy and equipment recommendations. Your surgeon knows best and will tailor your treatment to your spine conditions and needs. So it is important to continue to develop that rapport with the surgeon and get any necessary questions asked prior to your surgery. So planning before your spine surgery. During the last visit with your surgeon, you likely established a pain plan and management and expectations after your surgery. So some of the things that you might think about bringing to the hospital would be comfortable clothing and shoes for physical therapy, and some clothes to change into for your discharge. Bring a list of your medications with the dosage and how often you take them. And that will be discussed with your physician when you come into the hospital, and your nurse. And if you have sleep apnea, please bring your CPAP machine, although our respiratory therapists do have machines available if you do not bring yours. Okay. Planning before your spine surgery. Please review your advance directives and expect a pre-admission phone call. Our scheduling office will call the day before your spine surgery to confirm the time you need to be here at the hospital. Okay, so the day before your spine surgery, do not eat or drink anything after midnight, and those things will be discussed with the pre-op with that pre-op phone call. Per your nursing pre-op or spine visit, there may be additional directions regarding showering the night before or the morning of surgery. And please remember to remove all your jewelry prior to your surgery. Okay, so what to expect the day of surgery. So when you come into the hospital, you'll go up to the pre-op lounge. They will admit you and get an IV, start an IV on you. You may also have a urinary catheter, dressings. You'll have an incision, of course you'll have a dressing. You may or may not have a surgical drain. And you will have leg compression device, which we utilize to help increase your circulation after your surgery. Oxygen may or may not be needed. Okay, so your surgeon, you and your family, the advanced practice practitioners, either a nurse practitioner or a physician assistant, a registered nurse, nursing assistant, physical therapy, occupational therapist, and your case manager is part of the spine team members. So you will have the opportunity to meet all those team members. So the goal of treatment, the goal of the spine team is to treat patients and families with courtesy and respect, to develop effective communication with a plan of care. Pain management is a goal of ours too. Teaching about spine surgery and medications, assist with recovery after surgery, and to make your hospital stay a comfortable one. Okay, spine surgery day. So after your surgery, you'll come to our neurosurgery unit, and you will, that day of surgery, also depending on what time you get out of surgery, it is an expectation that you will get out of bed that day, and at least, based on your tolerance, get up, walk, and move around. Again, it's based on your tolerance, but at least sitting up on the side of the bed is a goal. After your lumbar surgery, the best way to lie in bed is on your side lying with a pillow placed between your knees. You will be encouraged to do coughing and deep breathing, utilizing our incentive spirometer, which I do have one here, but these equipment devices will be on the table over there that you can see. And so the purpose of the incentive spirometer after surgery is basically to increase your oxygenation to help your lungs stay healthy after surgery. You'll start out possibly with a clear liquid diet and advance to a regular diet. It's all based on your tolerance. And we will bladder scan you after we remove the catheter about every 4 hours to make sure you're not retaining any urine in your bladder. So the day after your surgery, again, expectations is to sit up in the chair for all your meals, sitting at the side of the bed, standing, walking, and therapy, physical therapy will be, and occupational therapy will be available to help with that. If there's any dress and change needs, we will do that. Bathing instructions, just trying to get you ready for home and how to function at home. Urinary catheter and spine drain, if you have one. That you may not have one, but if so, they will also be removed the day after surgery. Okay. Our daily multidisciplinary spine rounds. The spine team will round daily. We round at 11 o'clock with the physician, case manager, physical therapy, occupational therapy, just to help discuss your discharge needs. A spine team will round daily to perform focused neurological exam on you. The surgeons usually round around 6 a.m. and this is a good time to have a family member available to ask questions if needed. That's a good time to address any of your needs with your surgeon at that time. Of course, your family members can stay overnight. They can discuss that with one of the nurses on the unit, and so we can make their stay comfortable so they can be there already at 6 o'clock in the morning. So your pain expectations. Pain is expected after surgery. It may decrease but not entirely eliminated. But our goal is to get your pain level around 4. Everyone's goal is going to be different though, but that is a set goal. We encourage weaning off any narcotics prior to your surgery, and this will help improve and decrease dependence on medications. NSAIDs like Motrin and Aleve are highly recommended prior to and after surgery. And if you have a spinal fusion, Tylenol is recommended after surgery to help delay bone healing. Okay. Pain management. Your comfort is our priority. So moving helps reduce pain, even though it doesn't seem like, it makes sense, but moving helps to reduce pain. So if you take your pain medications and lessen your pain, you will be able to move better and, have a better outcome. Increase sitting, standing, and walking to tolerance level unless specified by your spine surgeon. Expect to have some pain while sitting and getting in and out of bed. The pain goal is around 4, like I stated. Scheduled pain medications are automatically ordered by your surgeon and offered to you. You and your nurse can develop a report about how you want your pain medications. We usually order them about every 4 hours. And we will have the doctor usually order something to be given in between that time if you cannot tolerate that 4-hour limit. So that discussion needs to happen between you and your nurse. We have we utilize the Wong-Baker face pain rating scale, which you will get when you come to the unit. And because comfort is our priority, we have this scale here. It has on a scale from 0 to 10, but as you can see, probably the 0 is much different than the 10. So our goal is around 4 for you to be able to move around, maybe with some pain, but not excruciating pain. So it is a scale that translates pain into a numerical scale to determine how best to treat your pain. Medications. Pain medications are ordered as scheduled or as needed. Like I stated, PRN is the terminology that we use for additional pain coverage. That would be the pain medication used between that 4-hour span. Daily home medications will be given as ordered by your physician. Other medications may be ordered by your spine surgeon, such as a stool softener. Because some narcotics can cause constipation, we like to make sure that doesn't become a problem for you, so we give stool softeners once or twice a day. Medical equipment. So we have a table over here that has some equipment on it. Some of the equipment you will utilize, some of it you will not. But for the most part, sequential devices or SCDs, you will have after surgery, and that is a device that helps increase your circulation. Also the incentive spirometer, which I just demonstrated for you. And this is what you'll have on your legs after you come from surgery, and it kind of increases pressure to help get the circulation that your body needs. Okay. Infection prevention. Always wash your hands with soap and water. Follow your surgeon's instructions for dressing changes. While in the hospital, we monitor your temperature and incision to monitor for any signs of infection. And at discharge, you will be asked to check your spine incision, or family members should check your spine incision for any signs and symptoms of infection. And those instructions will be given to you on the day of discharge. If you experience difficulty breathing, notify your nurse or call 911. So that's at any point in time. And please, no smoking. Smoking does decrease the blood flow, therefore decreases healing, and it can increase infection rates after spine surgery. If you have a cervical or lumbar fusion, the risk of fusion failure is 4 times that of a non-smoker. Nicotine of any type, including cigarettes, pipes, smoking, nicotine patches, tobacco chewing, can all increase the risk of spine fusion failure. So please avoid smoking during this surgical time for you. Discharge planning. Discuss with your spine surgeon what the expected length of stay is in the hospital. Usually 24 to 72 hours, but again, that is all individually based on your progression. Simple surgeries may go home the same day, and more complicated surgeries may stay longer. So it is important to identify a ride home for the day of discharge. Kind of do that early, and so you will, already have that planned. Case management. Case management, our case managers assist with coordinating home care or discharge needs to ensure safe discharge. So although the patients on the unit is seen by a case manager, and your needs for home, like walkers or canes or anything like that, is discussed at that time, and those are based on physical therapy's recommendations. So you will see a case manager who will help you with your discharge needs. Multidisciplinary rounds, day of discharge. So this is the day you want to address any type of medication concerns, pain medications or otherwise. Evaluate equipment needs. Your therapist, like I say, will help recommend if there is any needs, and the case manager will help assist with getting those devices for you. Discharge appointment reminders. Those discharge instructions will be given to you by the nurse on the day of discharge. Follow-up appointments, return appointments, medications, and those kind of things. So please have questions readily available. Family and caregivers are encouraged to be at Henry Ford West Bloomfield early on the day of discharge. Our discharge goal is around noon. So if you know in advance, which that is the goal for you to know that, please plan to have a ride around 12 noon, the day of discharge. It's a goal, but if you can't do that, it's okay. But that is our discharge goal time. Spine surgery recovery. Surgical recovery is a team effort. While at Henry Ford West Bloomfield, we will work as a team to help with physical therapy, occupational therapy, nurses, nursing assistants, and your family too we will all work together to help speed your recovery. After discharge from the hospital, walking every 1 to 2 hours is encouraged, and it is an expectation. It helps promote healing and decrease pain. And you should take your medications prior to your activities, kind of schedule it prior to your activities where you can get the optimum goal of that. Home care. Follow discharge instructions. Keep a diary of your pain medications at home so you won't double take. So if you're taking something every 4 hours, make sure you write it down when you took it and when the next time is due. Begin weaning off pain medications prior to your post-op visit. So usually it is recommended that you are seen in the clinic 2 weeks after discharge by a physician assistant or a mid-level. And at that time, we encourage you to wean off your pain medications. And if you find that your pain is increasing, you need to discuss that with your physician prior to that time. Keep a diary of sitting, standing, and walking. So you gradually increasing your activity. Keep a diary of bowel movements, because that's important to know, so you won't get constipated. And call your spine surgeon's office if you have a fever or concerns about your incisional site. So if there's any redness or drainage, increased pain, swelling, any of those things. And again, those instructions will be given to you on the day of discharge.